Welcome to the ACE Hot Topic webinar titled How to Rapidly Deploy a Telehealth High-Risk Program. I'm Jen Wood, Meetings and Administrative Manager for ACE. I have a few housekeeping items before we begin. The ACE membership year ends on June 30th, and we will be rolling out a new membership database and renewal process this year. In the coming weeks, we will be reaching out to our current members with additional information. We look forward to launching this new system in early June. I'm also pleased to share that ACE has created a monthly webinar series titled Delivering Cancer Care in the COVID-19 Era. The first session is on the topic of practical approaches and is scheduled for Thursday, May 21st at 1 p.m. Eastern. Please visit cancerexecutives.org/webinars for more information and to register. This webinar is being recorded and it will be posted to the members only section of the ACE website. We will be pausing for questions throughout the webinar. So if you think of anything during the presentation, please submit your questions through the question box in the GoToWebinar toolbar. It gives me great pleasure to introduce today's webinar speaker, Feyi Olopade Ayodele. Feyi is the co-founder and chief executive officer at CancerIQ. After starting her career in finance and management consulting, Feyi pursued her passion for precision medicine by transitioning into a role at University of Chicago's Comprehensive Cancer Center. To scale some of the lessons learned from the University of Chicago, she founded CancerIQ, a platform that helps providers use genetic information to predict, preempt, and prevent disease. Since launching in 2015, her solutions have been rapidly adopted by leading health systems and now serve over 250,000 patients a year. In 2019, Feyi was named to Crain's Chicago Business 40 Under 40s list for her work expanding genetic services more broadly into the community. Feyi and her company have been featured in publications such as the Advisory Board, Becker's, Genome Web, and the American Journal of Managed Care, and has been invited to speak at multiple conferences, including the Association of Community Cancer Centers, the IHI Quality Forum, and Cleveland Clinic's Medical Innovation Summit. She is a two-time speaker at the ACE annual meeting, and we're excited to hear from her again today. We hope you enjoyed this webinar. Take it away, Feyi.
Thank you so much for that introduction, and thanks again to all of our ACE attendees. Again, this is a very interesting time that we are all in, and I'm here to share lessons learned. We've had so many clients across the country who had established well-run high-risk programs that have been incredibly impacted by this COVID-19 crisis. And we've worked together with them to take their practices virtual, make sure they're getting to those patients, and ultimately set them up for this new normal of virtual care. Because we've seen incredible things happen over the last month. We've seen dramatically falling cancer screening volumes. We have seen incredible drop in cancer patient visit volumes. And this has made it so it's really timely for us to think about this new virtual model of care. Just so you understand myself and our context of what we do, that's what we do at CancerIQ. Our platform helps leading cancer programs start, run, and grow their own high-risk programs by automating a lot of the process. We have solutions to help screen and identify patients appropriate for genetic counseling. We have solutions to streamline the genetic evaluation process so that genetic counselors can spend less time in admin work and more time on patient care. And we also have a solution to help manage those patients over time so that they can be adherent and return back to your high-risk program and your health system for their medical care. But at the core, we are a data-driven company. And we not only monitor the health of every single one of our health system partners and customers, but we use this data to identify best practices and share those across the CancerIQ network. And the best practices I'll be sharing today have come from the over 60 hospitals across the country that have chosen to work with CancerIQ and move in this transition to virtual care with us. So my agenda for today is to share some of the data from some of our top performing programs that are enabling virtual family history screening, virtual genetic counseling, virtual high-risk management, and show you exactly how this might work in your own cancer program. But then I'd like to focus on a more timely opportunity, is that there's incredible innovation that's happening right now, and there are funding opportunities to support that level of innovation. And I'll share more about what our clients have done to take advantage of that. And then lastly, because there are just so many frequently asked questions about this model of care and the funding opportunities, I will spend time at the end answering your questions, but also answering some of the frequently asked questions that I know so many people on this webinar have asked my team in advance. Without further ado, I'll get started. So our first segment of our talk today is about virtual family history screening. And there are really three different models of care that we've observed across the CancerIQ network. The first of those is running a social media campaign or website campaign to try and identify patients for your genetics program and really draw them in. The second is more of a proactive email campaign that will actually come from the patient's provider or one of the referring physicians in your practice. And then the third is a model where patients are actually screened the same way they are when they come in, but they do this virtually as part of the virtual check-in process. And across all three of these models, we have tons of data and evidence on its success. So let's start with the first implementation model for family history screening. And this is really by collaborating with your marketing or business development team that may be a little less busy than they normally are, and helping them launch a proactive effort to get patients engaged in preventative screening. Our clients have done this by first investing a little bit more in their homepage, making sure that the genetic service is more clearly highlighted. But instead of just explaining the service, there's actually a call to action for patients to take an assessment and understand if they're appropriate for your high-risk program. Patients, once they engage with that call to action, they not only do their questionnaire that takes less than 5 minutes, but at the end of that questionnaire, they actually get tailored education and a little bit more information as to why it's important for them to follow up with their provider about a genetics referral. This can reduce the amount of time that the patient actually needs to speak to their provider and ultimately makes them more likely to follow through with that genetics recommendation. And on the back end of all this is access to a full registry of all those patients who met criteria and should be in the pipeline for your genetics program. And at a time where maybe your navigation staff is not as busy, or members of staff in your cancer screening programs are not that busy. Someone can man this, reach out to those patients and educate them, and ultimately make sure they're successfully navigated over to your high-risk program. So that's one of the models of implementation that we've seen to proactively build volumes for your high-risk program. The second model of care that we've seen is really proactive screening via email. There have been challenges in that first approach that I just shared. Patients don't know who they're providing this information to. And while many people have clicked on that call to action to take an assessment, we haven't seen as much uptake or completion as we would like. Feedback that we've gotten from our patient-centered advisory board is that maybe we need to communicate from someone they know, build that level of trust. And there's no one better to do that than that patient's provider. But how do you get them engaged? Step one of the process is making sure you have proactive outreach to the preventative care providers that are also working remotely. The first thing that you can do is explain to them why. Why is this important for them to take on? Second thing you can do is make sure that it's very clear what the benefit is for them. If you're in a fee-for-service environment, doing a family history screening or genetic screening in that consult can increase the complexity and allow you to bill at a higher tier. Or if you're in a fee-for-value environment where getting ahead of cancer is truly your business model, you can use CancerIQ to identify maybe those average risk patients that could benefit from an at-home cancer screening like Cologuard instead of needing to come into the hospital, because you want to make sure as many of those patients adhere to the cancer screening recommendations as possible. But ultimately, if you frame it in terms of what's in it for them instead of what's in it for your high-risk program, they'll get a really great response. But there's a second element of this email that's really, really important, because everyone is stressed and everyone is a little overworked right now. Frame it and make it very clear that there's actually no extra work for the provider and that your team will do everything for them. And by your team, we mean your team plus CancerIQ. Because this is what we've helped our clients develop. We have learned some of these best practices in patient education and communication, and we've bottled them up into emails that can help your patients take action. First best practice in this email is to explain the why. You know, asking someone to update their chart in Epic doesn't really mean anything to someone. But if you tell them that you need to actually, have them redo a family history screening or CancerIQ assessment because guidelines are constantly changing and you want to be on top of those guidelines and make sure that you're doing absolutely everything you can during this difficult time, that's a why that gets people excited. But there's a second element to this email, telling that patient's story. If you haven't gathered these already, now's the time. People really follow other references that they can see ahead of them. And in this particular email, we were able to embed a patient story and say, here's someone just like you who benefited from this service. So they not only see the why, but they see, again, another thing that's in it for them. And conclude in this patient email the same way that you would the prior one, by showing that there's little to no work involved. A CancerIQ questionnaire, even with embedded education, can really take patients about 5 minutes to complete. And at a time where people are at home, they have the time, and they're even with their family, a lot of patients are moving forward by taking action. Because here are some of the results that we've seen, and here's one of our sites that proactively reached out through their breast center to almost 20,000 patients. Again, these are patients that weren't coming in. These are patients that are following stay-at-home orders. These may have even been patients who had appointments scheduled, felt comfortable and aren't in stay-at-home orders, but didn't feel confident coming back in again. This may resonate with a number of people in this audience. And with that email campaign, we found that about 400 patients opened that email. Over half of them actually completed the questionnaire. And within 1 month, they were able to schedule about 58 patient virtual visits through that email campaign from the provider alone. So this is a second way that you can virtually screen patients without relying on them to come into the hospital. Now, the third is an upgrade of even that second approach, because this virtual screening methodology is screening those patients the same way you would as if they had come in for an in-person visit. Because CancerIQ has focused most of our efforts on the technology side have been on making sure CancerIQ can truly be embedded in routine care. And to do that, we have built apps that are now available through a number of leading EMRs. And by opening the EMR, you can launch a CancerIQ app and have it embedded right there in the window of your EMR. What this means is it's also a lot less work for your technical teams that may have been pushing back on EMR integration year after year. And it can also be front and center for a lot of those preventative care providers who aren't going to log into another system. So when they start their visit, they can actually start a screening. They can launch a survey code, and that patient can use that survey code to complete a questionnaire on any device that they have access to, be it the web, phone, or computer. And when the patient's done with their questionnaire, that information goes straight into the EMR and automatically interprets if that patient is eligible for high-risk care or not. It's because of these virtual features that CancerIQ is truly classified now as a connected care solution, because we're going outside of the walls to get that information from patients, and we're bringing it into those solutions that your providers are already using on a regular basis. If you're looking to quickly stand up a virtual screening process, there's no better place to do that than on the screen that your providers are using on a regular basis. Because providers can see that information quickly, and they can increasingly take action. They can log if the patient's interested or not, and now you've built a pipeline for your high-risk and genetics program. Here are some of the results that we've seen from that process. This is an example of one of our clients who, like many on the line, have seen a dramatic drop in referral volume, almost to the point where no patients were referred from their preventative screening program to their genetics program for almost a month. By starting this virtual screening process and making it part of virtual visits, they were able to resume that routine screening process and almost fully rebound to the volume of patient referrals within 1 week of launching this virtual screening process. We've seen things evolve, and as this becomes the new normal, more and more patients are going to take advantage of this in-visit screening process and trust their provider to take the next step. So that brings us to the third virtual screening mechanism, and that is truly delivering virtual visits. Any questions on the upfront screening process before I move on to the genetic counseling experience? All right, so again, for a number of our cancer center executives, you have already made the investment in genetic counseling program or plan to make an investment in a genetic counseling program. This next portion of our talk today is going to be about how you can sustain that program during this time where that funnel of patients may not be as high. So the first part of the genetic counseling appointment that has dramatically been enabled by the COVID-19 process is that, in fact, there is better reimbursement for telehealth, but they're also relaxing some of the HIPAA compliance rules regarding some of the audiovisual features of telehealth solutions. The Office of Civil Rights has actually waived things as long as providers are in good faith trying to deliver virtual care. And that's opened a number of really easy to obtain audiovisual solutions that your genetic counselors or genetics providers can use to deliver virtual care. And here are just some of them that are HIPAA compliant already that a number of our clients are using. Because there's so many of these audiovisual tools, CancerIQ has rapidly modified our platform so that we can incorporate those kinds of tools. Because unlike an audiovisual appointment that may be with a regular provider, a genetics provider, and in the context of a genetics appointment, is going to need a little bit more than just the audiovisual solution that your IT team has offered you. Because to deliver non-inferior care and make sure that patient is truly understanding what's going on with their genetic risk, they not only need to see your genetics provider's face, but they also need to see the genetics provider's screen. So that's why we've evolved our platform to integrate with a number of the audiovisual tools we already have and enhance it with the things that are needed for a genetics consult. The first of those being a way to gather more comprehensive family history information. Again, the patient can do this in the comfort of their own home. It's in bite-sized modules so that many of these patients are completing this in advance of an appointment instead of the genetics provider needing to ask it then and there. The second key component of a genetic evaluation appointment is for someone to be able to see the patterns of cancer in their family and understand, why they might be an eligible candidate for genetic testing. While this might be something a genetic counselor could accomplish with paper and pen in clinic, this is absolutely something that is part of the experience that would be missing from this video consultation. So with CancerIQ, the genetics provider can open up to this so they can see their face and they can see these visualizations. They can see their risks relative to the general population. They can see their risk may warrant something above and beyond standard of care. And all of these things are really important for shared decision making, which is also part of the CancerIQ platform, so that patient can make a plan to stay ahead of cancer, detect it early, and hopefully prevent it altogether. Now, aside from those visualizations that are important for the genetics consult, there are important things to make sure that your genetics providers are not burning out while all working from home. There's an incredible amount of documentation work that a genetics provider typically needs to go through, which can account for some of their low visit volume. And with CancerIQ, with a few click of a button, they can wrap up on that consult and be available for another in a matter of minutes and not hours. We help generate patient letters that allow the patient to take action. We even generate some of the prior authorization paperwork that's needed for that provider to take action. And ultimately, those are things that are auto-generated from our platform immediately after that consult. Now, a business model for this virtual care is a question we get asked about all the time. If you are able to bill for counseling, there are a number of different coding references and CPT codes that we've seen our clients use very successfully. But even in the context where you can't exactly do that, there are a number of genetic counseling teams that are thinking ahead about how they can be team players and actually think about some of the downstream revenue they can generate if they're unable to bill in the short term. So many health systems, so many hospitals, so many practices have been hurting financially due to the lack of preventative procedures or elective procedures in their health systems. Your genetics team can actually be a source for your team to be able to rebound if they're able to stay open and operating and seeing patients during this time, so that when things open up, you can prioritize some of the highest risk patients for these procedures that were unable to be delivered during the COVID-19 crisis. And a great example of that is our client that is at Dignity Healthcare. They've been running a virtual genetics program that has actually increased in patient volume throughout this crisis and is one of our highest performing sites. Even though they don't bill directly for genetic counseling services, because they're able to see so many patients and log what intent those patients have throughout the health system, we're able to quantify the number of preventative services or MRIs and prophylactic surgeries and other more frequent cancer screenings that they're able to generate elsewhere within the system. What you're looking at here is really just about 6 months of data, and they are doing incredibly well during this COVID-19 crisis. So if you're looking for justification and you're trying to figure out what you can do to contribute and continue investing in this genetics program, even though they aren't able to bill, look towards the future, and please ask us about any other such case studies like the one at Dignity Health. So that rounds up my portion on the genetic counseling portion. Any questions about that before I move on to high-risk management?
Hey, Feyi. Yes, we have a question that came in, and that is, during these virtual visits, you're saying that the provider would be able to share their CancerIQ screen with a patient during the virtual visit?
Yes, absolutely. In the same way that all of us are getting used to WebEx and GoToMeeting and formats where we could share the slides in this webinar, that's exactly what a genetic counselor could do to make sure that the patient's getting the equivalent experience that they would in person.
Thank you.
All right, wonderful. And again, for our Cancer Center leaders on this call, if you haven't been in a genetic counseling appointment, this is a great time to learn a little bit more about their workflow. It truly is an important part of the patient experience that you want to keep equivalent in this virtual environment. Okay, so now let's talk about high-risk management. These are patients who have been through that genetic counseling experience and are at the highest risk for developing either a secondary cancer or cancer for the first time. For this, CancerIQ has very, very important solutions. One of the things that is critical to our product suite is the CancerIQ Manager, where you can actually set up a lot of these patients who are in these high-risk areas for ongoing management by your high-risk care team. The care team will receive alerts when that patient is due or overdue for any sort of preventative services, and will be able to be proactive in reaching out to those patients who may be too anxious to come in for care, and make sure that they find a plan to come in or are at the top of the priority list as soon as things reopen. There are also reminders that are tailored and educate the patient on the importance of that preventative screening so that they don't go a full year or 6 months without getting that really important high-risk care. And here's one of the perfect examples of the benefit of the CancerIQ Manager, especially during a time where you may have time to clean things up and start reaching out to some of those patients that have been lost to follow-up. This is one of our clients who has used CancerIQ really for about the last 6 months, and they had a program that was very robust, and they had tested so many patients. Many of these patients were supposed to be coming in to the breast center for breast MRIs, and that's how they justified establishing such a comprehensive high-risk program. Well, prior to CancerIQ, they had sent letters to patients and kind of hoped that they would come back. And really by adopting our system of reminding both the provider and the patient about next steps, they're now seeing 2 to 3 MRIs a day. And during this crisis where you really do need to make sure you're focusing on those highest risk patient populations, we see that as a win-win no matter what business model you have in your health system. Now that I've gone through these 3 models of care, I'm going to talk about what a number of cancer center executives are thinking about when it comes to how you can actually activate and implement these kind of virtual services at a time where budgets are constrained and projects have been frozen. I'm here to talk about some of the funding opportunities we've seen for telehealth services and technologies and how to secure funding for the technology you need in your program. As part of the CARES Act, there was $200 million that was dedicated to a COVID-19 telehealth program. This program was specifically for providers to request up to $1 million in reimbursement for any sort of telecom services and broadband, information services like CancerIQ, and any sort of connected devices or equipment that you need to make this transition to virtual care. All that's required is that you register with the FCC and with the Federal System for Award Management. And like so many of our cancer center clients that have participated in some sort of clinical research or maybe gotten a government grant in the past, you should already be registered with both the FCC and the System for Award Management. Rolling applications for this opportunity and the stimulus opportunity opened about a month ago, and they've already deployed about 25 million of the 200 million they had dedicated to this program. Now, I'm sharing more about this because it was actually our clients that saw the very clear correlation between what this stimulus program is for and what CancerIQ ultimately does for the Cancer Center. First, we provide asynchronous transfer of patient data for interpretation by a physician or provider. We are taking that family history information and transforming it into something that the provider can easily interpret and act on. We're almost like that, Fitbit for your family history, where data outside of the health system is ultimately being gathered and interpreted real time for a provider. And that's the kind of solution that they'd like to fund. Second thing is that they are looking to support or reimburse investments in platforms and services that provide synchronous video consultation. And as I mentioned before, a genetics video consultation is one that really does require not just the human eye touch, but it does require those visualizations to be most effective. So by integrating that with the audiovisual system that you already have, and maybe your system has already applied for funding for, we're really an enhancement to what you have in place. And then the third way that we fit in is they're looking for as many solutions as possible for patients to report their outcomes. And the CancerIQ Manager is designed to do exactly that, right? At a time that they don't want to come in, that patient can report their intent. They can report their challenges, and they can actually report their compliance without you needing to see that patient at all. So because of those three things, we are truly eligible as a service that enables virtual care and keeps high-risk patients out of the hospital and fits within a lot of the key selection criteria that the FCC has publicly stated they're looking for. So in terms of the conditions to be treated, again, we are truly focusing on those with cancer and survivors of cancers or those with a cancer predisposition. We already know that patients who have cancer or survivors are actually 3 times more likely to succumb to COVID than your average patient. So projects that highlight services that are for that patient population are things that are going to be looked upon very favorably by the FCC. The application looks at the goals of objectives. One of those objectives can be to keep these high-risk patients out of the hospital. Another also important objective could be to retain staff that you may otherwise need to furlough or may otherwise, reduce hours. So having a goal or objective that is also about saving jobs is very aligned with the intent of this stimulus funding. You need to explain the timeline for deployment, and here is where we also have some good news, especially for our clients that have already, been CancerIQ customers or have taken advantage of our 90-day telehealth opportunity. You can actually pay for program expenses that you incurred as far back as March 13th. So if you have been spending money on this is a great way to get reimbursed for that. And the last 3 things that they're looking for in the application and will be selection criteria are just how are you measuring impact? What is the geographic area or population served? And what specific, vulnerable patient population are you uniquely addressing with this service? And a number of our clients have done an excellent job working with our team to help them put this together and put in very strong applications, excerpts of which I'll share today. Here are some of the things that we have seen that have yielded some very successful applications. One is expanding the scope of your high-risk program beyond just genetics. One of the ways you can start your application is by thinking about your oncology patient population. How can you offer genetic counseling to that patient population virtually? But what makes applications even more compelling is expanding the scope, not just from your oncology patients, but maybe to those cancer screening sites that are experiencing a huge drop in their traditional cancer screening volume. By expanding the scope from oncology to those cancer screening sites, you're not only touching more patients, but you're touching more staff members and healthcare members of the team that can be engaged with CancerIQ during this difficult and low volume time. But the third group that you can expand to, and again, this is where we've seen some of our most ambitious projects that the FCC is looking to award funding to, are projects that not only think about those cancer screening sites, but think about some of those affiliated preventative care providers who, because of population health initiatives or alignment with some of their professional society guidelines, really see this as habit and as something they should be doing as part of their routine care. If you could get all three of these stakeholder groups together, you can apply as a consortium and show a much higher impact on patients and job retention than if you're just thinking about your cancer center alone. Now, if that is raising your anxiety because you need to go get the sign-off from all three of these different stakeholders, one thing I will definitely add is that a lot of our clients have applied for this without needing to go through multiple committees because they've simply said, listen, we have a way to help, and in order for us to help, we need to act quickly because this FCC stimulus funding is only available first come, first serve. So trying to rally people together the old, slower hospital system way has never been, is going to diminish the likelihood that you may ultimately get funding. So putting all three of these groups together in conjunction or collaboration with the CancerIQ customer success team can make your life easier and hopefully cut through some of the internal bureaucracy. Because our team has helped so many of our customers really tag team a successful application. Our clients have taken a lot of the work obtaining an FCC number and making sure you're registered with the System for Award Management and really doing a lot of the heavy lifting on that side. And our team will also look up those numbers and verify those with you if needed. But just like our customer success team will develop a project charter for any client and for anything that they do, we will very well define, the description of the services, how it is aligned, how it's going to help, prevent COVID or enable social distancing. And a lot of those things that we know are important in a successful application. So that's how we've truly partnered with a number of our customers who have done this so that they can continue investing in their high-risk programs. Ultimately, taking things across the finish line are truly a partnership. Finalizing the scope and making sure you get some numbers for all of those places and those patient populations you intend to touch. Splitting it into two, so we're drafting our section and our customer success team will do a project charter for you and define the scope of what this project will be. And then lastly, making sure that we can regroup and quickly submit something before the FCC is too overwhelmed with applications is really the name of the game, and how so many of our customers have acted so quickly to not only rapidly deploy a new program, but to be able to get the technology infrastructure that they need. Ultimately, because this is first come, first serve, we've been able to do this in less than 24 hours turnaround. So if you'd like to speak to anybody on the CancerIQ team to learn how others have done this, please feel free to reach out. Because we see the CancerIQ opportunity and the virtual care opportunity to be something that's not going away. Ultimately, by transitioning to virtual care, you can truly enhance the patient experience of your cancer program. You can make sure that you're maintaining, patient care safety and population outcomes. You can actually improve staff productivity while people may not be able to come in every day. And you can reduce some of the staff burnout that may come from not only being a genetic provider, but needing to do all sorts of documentation work that is slowing you down. Ultimately, we believe that this decreases the per capita cost of care It can help attract new patients and increase patient retention at a time that patients are really not feeling engaged with the hospital. And if you do this quickly enough, you can truly differentiate your service from other competitors. But what warms our heart at CancerIQ and what we're increasingly trying to see is that, ultimately this is something that's going to help save lives and prevent adverse outcomes. As we see patients truly delay care, and later stage cancer diagnosis could be what we see as a consequence of this. So we encourage everybody to act fast, ask any questions that you have on today's webinar, and work with us so that you can make that transition. So I'll pause there and answer any questions related to the funding opportunity. And because I know so many attendees came today to hear some of the questions they've been asking most frequently, I also have a section here of some of the key questions that we've heard already from the market.
Sure. So Feyi, I have kind of an overall question for you, and it's asked: do you envision that the services that you presented shifting to a more virtual platform, becoming a permanent fixture in our lives?
Absolutely. I think one thing that I've seen is, from a patient experience perspective, especially within cancer centers, there's just so many appointments, and there's so many services, and there's so many things bringing patients that really do have very high anxiety over COVID-19, requiring them to come into the hospital. So we believe that even as cities open up or states open up, the cancer patient population is still going to feel very uncomfortable exposing themselves in the hospital setting without a vaccine being in place. So we do see this happening until we actually reach that time.
And that is it thus far. So why don't you give our viewers some of your frequently asked questions? I'm sure that'll help encourage additional conversation.
All right. Okay, so here are the questions that have come up, again, from our clients during the application process. One of them was, first, is there an official deadline to apply for funding? The answer to that question is actually no. Again, it's until the $200 million runs out. It is first come, first serve. So we want to, as much as possible, encourage people to get ready to at least lob in an application, even if they haven't figured everything out yet. All right. Our next question, again, that came from attendees who prior to this call was, what's the maximum amount of funding that we can apply for? So the FCC has basically not actually given a maximum, for any health system, but they have said that they don't anticipate to award more than $1 million to any one applicant. Okay, and this is actually a frequently asked question. An applicant can be any individual practice or hospital. It really is just defined primarily by your location and an NPI number of a clinical lead. So what we have seen is that they don't want to see any more than $1 million in an individual applicant, but there could be, several million dollars awarded to a health system if you look at all their applicants in aggregate. Which leads into the third most frequently asked question that we've heard is, if my health system or corporate entity has already applied, does that mean that we can't apply separately? We have been in contact with the FCC and, again, been there as our clients have done this. Several of our clients are some of the largest health systems in the country. And even though there may be a corporate applicant who has already applied for $1 million in funding, it does not mean that your specific organization or local hospital cannot apply. In our conversations with our contacts at the FCC, again, they have clarified multiple times that this is possible. So if you have gone to your leadership and they've said, we don't want to jeopardize the bigger grant, we don't want to, jeopardize our application as a corporate entity, this is again a lesson learned from our clients that have already done this, knowing that the FCC is willing to consider awarding a funding commitment to each individual entity. Another question that has come up, and I will provide and share some of these written answers, is, we already have a handful of telehealth solutions that are already vetted and live on the system. And we're not sure if we have the ability to introduce yet another telehealth solution. This has come up very frequently because for cancer service line executives or oncology executives, it can sometimes be challenging for you to understand what your genetics team wants. It's even more challenging for people in central IT to understand what your genetics or high-risk team wants. And it can be difficult for them to differentiate between, Zoom, we've already bought Zoom, or we've already bought, VC, and what we are offering at CancerIQ. The difference between those solutions and what we do at CancerIQ is we are modifying that audio-visual visit that could be run through a solution like Zoom or VC, and we're making it so that there's genetic-specific content. So if you're looking for, one-liner or, how to push back on that IT person that says, I've already given you a telehealth solution, make it very crystal clear that a genetics telehealth consult requires some specialty-specific tools and equipment that does not overlap with those other telehealth solutions. This can also help you if you are considering an application for the FCC telehealth funding opportunity, because you do have to make a very clear statement that you have not already applied for the same software and services. Part of the reason that we integrate with your audiovisual services is so that you can make that claim in good faith, because CancerIQ is an enhancement to the tools you may have already investment in, and not something that competes with the tools that you've already invested in. Jen, feel free to interrupt me. I have, I think, a couple more.
I think you seem to be answering the viewers' questions as you're going through, because we currently do not have any questions on the docket.
Okay, wonderful. Great. So then our last, I think our last question here is just, again, something I reiterated earlier in terms of the definition of virtual care. If you're looking for these things or are stumped on how, to frame this in the specific application, we're more than happy to partner with you and introduce us to the team that's been helping. So again, I wanted to, spend time and maybe give everyone 5 minutes back if they'd like, and say thank you for everyone attending today. Again, we have done a lot to get our clients to move to a virtual care environment. We have leveraged technology in the way that everyone needs to adopt technology, not only for today, but for the future. And our team is available to answer any questions or best practices you might be looking for as you try and recover some of those losses in patient volume that have happened over the last few months.
Thank you so much, Feyi. This was a fantastic presentation, and I think we've learned a lot. I do have one logistical question for you. I have a viewer who was asking, will you make your slides available to the listeners?
Absolutely. So please look out for email communication from ACE and from us with not only the slides that I presented today, but hopefully a nice recording for you to share internally with other stakeholders.
Fantastic. Well, thank you so much again, Feyi. We sincerely appreciate your time, and we appreciate everyone else's time who joined the webinar, and we hope everyone stays safe and has a fantastic day.